Good morning, everybody. This is Dr. Jacob Lilly here, and today we have an exciting video discussing a brand new study that just recently came out highlighting the importance of chiropractic care with intervertebral disc pain. Now we're going to jump right into it. Now the idea of this study is basically they had a patient with an acute flare-up of back pain who went in, and what they did was they took an MRI, an X-ray, and something called an MRS, which is a magnetic resonance spectroscopy, which is something I'm very new to understanding what exactly it is. But when I was reading this study, it was really mind-blowing in terms of the implications it can have with diagnosing lower back pain, but also even preventing lower back pain through early diagnosis. According to the study, what they did was they took a history, they did an exam, and what they ended up doing was they got an MRI, and that MRI clearly showed disc herniations at two levels, at L5 and S1, which is the lowest part of our spine right before it gets to our sacrum or our tailbone, and then they also found another disc issue at L2, L3. Now, the MRI itself, because there was two disc herniations, it's very difficult to try to pinpoint which area is the pain generator, which is the area that's actually causing the pain. Now, what they did and what they found is that the MRI is non-specific, which means that you can have disc herniations and they can either be asymptomatic, they can be symptomatic, or you might have multiple levels, and that's not very suggestive of which specific area needs the care. Now, why is this important? Because if, for example, you go to pain management and they want to do an injection, but you have 3 disc herniations back to back to back and on each succeeding level, that's going to be an issue because the MRI is going to tell you that there's 3 disc herniations. Now it's up to the practitioner to decide where that injection is going to be placed. What they ended up doing in the study is they got something called an MRS. Now what the MRS does is it doesn't necessarily check for disc herniations. What it does instead is it evaluates biochemical changes inside the discs and around the discs. Now, why is this important? Because we've been able to quantify how much this biomechanical change can actually be a part of that pain generating process. So for example, if there's an increase in this lactate and a decrease in proteoglycans with one level of the disc but not the other, we can actually look at that disc that's having those biomechanical changes. We can safely look at that area and essentially come to the conclusion that that's the area that needs the treatment first and foremost. So if you're dealing with multiple areas and only one of them is showing a difference in activity on the biochemical level, that's going to help hone in on our diagnosis on that specific level. And then in that particular case, the practitioner, in my case, chiropractor, would be best suited to look at that area specifically and treat that area specifically. Now, I talked a little bit about biochemical changes inside the disc. Now, what exactly are these? Well, according to this MRS, this magnetic resonance spectroscopy, they're primarily evaluating 2 things, which is lactate levels and proteoglycans. Now I'm going to explain what exactly these 2 are and why they are important for disc health and thus spinal health. Starting with number 1, proteoglycans. Now, why is this important? Is because when we have lower levels of these proteoglycans, such as with aging, the natural aging process will start to slowly decrease the amount of proteoglycans we have inside the disc. This will lead to degeneration of the disc. Now, this is another reason why having just an MRI to show that you might have a disc bulge or some sort of disc abnormality is not necessarily the best thing for diagnosing lower back pain, because as we age, which is everyone, we're going to have that subtle decrease in proteoglycan activity, which can eventually lead to degeneration. Now, what matters is that degeneration symptomatic or asymptomatic? Now, for a lot of people who get an MRI, they may be asymptomatic and it could just be a finding that they have on the MRI, but not actually explaining their pain, or maybe they don't have any pain at all. So in that case, what do we do? And this is where that MRS comes into play, because now it's evaluating a deeper level, a more specific level of proteoglycan activity as well as lactate. Now, lactate is going to be the next part of this. Now, what is lactate exactly? Well, lactate, a lot of people might kind of assume lactate as like lactic acid, which is very similar. Now, what happens is lactate is byproduct of glycolysis. Glycolysis is essentially just one way that we're able to make energy throughout the body. The disc itself doesn't have any real blood flow into the disc. How the disc actually stays healthy is a lot of the times through imbibition. Imbibition is essentially the swelling up of the disc, typically when we sleep, because of the lack of compressive load. So, for example, if you're standing up, your body weight and gravity is going to provide a compressive load on the spine, and that's going to help kind of push a lot of fluid outside the disc. Well, when we sleep at night, those discs at every level of our spine will essentially swell back up, kind of like a sponge, kind of pulling water inside of that. And that's that process of imbibition. That can also explain why typically in the morning we're a little bit taller when we stand up or sit down, and we'll actually explain why sometimes in the morning when we're on our drive to work, we have to adjust that rear view mirror because we're maybe sitting an inch or two taller than normal. Now, another note about imbibition is that it can be stimulated through mechanical movements. So this is where, again, movement-based therapies are actually really good for discogenic pains because of this process of imbibition. We're essentially moving the spine through certain ranges of motion, and this is going to help increase that imbibition of the discs, which will keep it healthy. Now, where does glycolysis and lactate kind of fit into this? Well, quite actually, when we have imbibition in those intervertebral joints, through sleeping or lying down, kind of removing that compressive load from the discs, or through movement, such as a chiropractic therapy, like an adjustment, or through some sort of movement-based exercise or treatment, the increase in imbibition in the disc is actually going to decrease the amount of lactate in the disc. Now, again, why is this important? Well, number one, lactate is a chemical byproduct of glycolysis. And now, according to this study, it's shown that increased lactate levels actually has a very, very negative consequence to the disc health. So, how do we remove lactate? Through imbibition. How do we do that? Usually through movement. Now, if we don't have that, we're going to have these increase in lactate levels, which is going to cascade into other things that's going to decrease the health of the disc, and as you'll soon learn, cause pain. When we're doing this imbibition process or imbibing the disc, there's going to be this exchange of nutrients as well as water from the disc. So essentially you can look at it as an equation. As lactate starts to build, we get this imbibition process that's going to push nutrients and water into the disc and kind of flush out those byproducts from glycolysis, which is the energy creating systems that our body produces. Now, this is where it gets really amazing. If we think back to what I said a little bit earlier about proteoglycans, those proteoglycans typically decrease with age. Now, what happens when we have this decrease in proteoglycans? Well, one thing is we have a decreased ability of imbibition in our discs. And now, as we just talked about, a decrease in imbibition will actually lead to an increase in lactate inside the disc. Now, what does this all mean? Essentially, we're kind of going down this path of altered biochemical and structural changes inside the spine, and more specifically the disc, which is going to have resultant effects to the structures above and below it, such as the spinal joints, such as the ligaments and muscles and all those things, because they all work together with stabilizing the spine. One of the biggest things that study highlighted is the effects of lactate, that byproduct that happens with glycolysis. Now, with the increase in lactate, we're going to have a decrease in pH, meaning the pH in the actual disc is going to become a little bit more acidic. Now, with this altered pH change, again, it's going to start to snowball effect and kind of cascade down to more negative things inside that disc. The decrease in pH is actually going to rapidly increase proteoglycan degeneration. So that same process of natural decline of proteoglycans is now going to be sped up because of the increase in lactate. So you can see how this loop is a positive loop, and it just keeps feeding onto itself unless there's an intervention placed to stop that. With this breakdown of proteoglycans, or rather this rapid breakdown of proteoglycans, in combination with the decrease in pH, making the environment inside the disc more acidic, you're going to have something called cell hypoxia, meaning the cells quite actually suffocate and essentially die because there's no oxygen to repair those cells and keep those cells metabolically active. Now, what does that do? That's going to do a whole bunch of changes to the disc, such as mainly when you have that cell death, you're going to undergo inflammation. Through that cell death, you're going to have this spilling of different chemicals from that were once inside the cell now spilling out into the environment. And what your body does is essentially mount an immune response, which is inflammation, to clean up that area. Now, what's the problem with that? Is that now your body is going to look at that area as a target and produce more inflammation. That inflammation is going to kickstart that entire process again, and a lot of the times it's what is going to be the cause of our pain. Now, how does this process kickstart and kind of promote pain? Well, the inflammation is the start of it. Now, with this increase in inflammation, we're going to now undergo neural changes where we're going to grow new nerve cells that are going to infiltrate into the disc. Now, with that, we're still potentially in this low pH environment, this acidic environment, and nerve cells do not like that. They do not like acidic environments, and they do not like rapid fluctuations in pH. What does this do? Now you have an environment that's not great for the nerves. That nerve is going to be ticked off, and it's going to continuously send signals to your brain, basically saying, hey, this area is painful. And then that's why we feel that pain. Now, why exactly is this important? Well, when we have this neural change where we're having nerve cells kind of grow deeper into the cell and essentially be exposed to these harmful environments inside the discs with the cytokines, the inflammatory signals, the lower pH, and all of those things, we're going to have issues with our lower back. Now, when we have this neural tissue kind of growing inside the disc, that's going to predispose us to potentially chronic pain, because now the nerves are going to be sensitized to that pain because they're kind of directly in that environment all the time. So if we continue to have these flare-ups of back pain, potentially it's because of that, and those continual flare-ups eventually can lead to chronic pain, and that's a big problem. So exactly how do we fix this? Now, this is where the chiropractic magic just comes in and blows this stuff out of the water. Now, according to this study, this patient that was dealing with this issue, they found, again, 2 levels where we had that increase in lactate levels, which again is a biochemical change of a disc injury. So if there's a disc injury, we can see it now through these biochemical changes, and we can again hone in and kind of specify what areas are painful. Now we need to figure out what treatments are best for it. Now, with chiropractic therapy, what we did in this particular study was for 16 weeks, for 16 treatments, so I'm assuming that's 1 time a week, we did a flexion distraction. Now, what this does is the flexion distraction table creates a mechanical movement inside the disc. If you've ever been on one, it's quite a fascinating feeling, but essentially what it's doing is it's removing the compressive load, decompressing the disc, and then it slowly returns back to normal, and then it goes back and again. And it basically just keeps doing that essential decompression and then returns to normal and repeats that cycle depending on how many minutes you're on it and how many revolutions of the table, sometimes hundreds of times. Now, why is this important? Well, again, if we relate back to what I said a little bit earlier about movement-based therapies and mechanical movements, that's going to drive imbibition. When we put someone on a flexion distraction table, that is going to provide that mechanical imbibition for the disc to heal itself. And like I said, with that imbibition, we have decrease in lactate levels. That decrease in lactate levels is essentially going to reduce the inflammation, reduce proteoglycan breakdown, and keep that disc healthier. On top of spinal flexion distraction, we have other therapies such as chiropractic spinal adjustments, the more traditional spinal adjustments where, typically you're laying on your side and then, we put force and, get a couple pops in your lower back. Now, this study actually highlighted the importance of that therapy because, again, we are introducing a mechanical force, a mechanical movement through our hands to, again, promote that imbibition. So you can see how there's multiple therapies that a chiropractor can do to improve your disc pain. One thing to note as well is that 80% of Americans are going to experience lower back pain in their life. Out of those 80% of people that will experience lower back pain, a vast majority of those people will suffer from discogenic pain. Now, as I said, the disc will eventually start to wear down as we get older. However, there are remedies for that. I just explained how important a chiropractic adjustment is for creating that imbibition. Now, if we can create that imbibition for years, meaning you're under chiropractic maintenance care for years, we might actually see a decrease in that degenerative cycle, meaning we might be able to preserve the disc for years before it actually starts to become an issue. Right? So think of all the spinal arthritis out there, the degenerative disc disease, diagnoses that are thrown out there, and how potentially we can negate a lot of those issues with consistent chiropractic care. Boom. This is a very, very important study showing the validity of chiropractic care in spinal disc pain and shows how chiropractic care is one of the best things for your pain. It's cost effective, it's extremely safe in comparison to surgery or opioids, and it is a very much natural therapeutic service where we're not introducing any harmful drugs or medications or risking any injections or anything like that. It is extremely important that chiropractic care be one of the main treatments for lower back pain. Now, one thing I want to end this on is that despite the study being an amazing study and, in my opinion, a proof that chiropractic care is fantastic for lower back pain, we also have to consider that this was only done on one person. So it's very difficult to take that one successful treatment of one person and apply it to the whole world of people. So that's one thing to consider. However, it is at least the start of something better in terms of chiropractic research, in terms of showing efficacy, in terms of chiropractic care for lower back pain. And again, kind of proving a lot of the haters wrong when it comes down to people kind of slandering the name of chiropractic, saying that it's not evidence-based or it's experimental treatments and things of that nature. Well, we can actually see and document now that it's not. Okay, it's actually an effective treatment for discogenic lower back pain. Hopefully this video was very insightful for you. Like I said, I'm very excited about this topic. It reinvigorates me when I see positive things like this in regards to chiropractic care because, again, we are very much important providers in the medical community for musculoskeletal pains, and lower back pain is one of the biggest inhibitors of return to work, return to activity for athletes and things of that nature. So chiropractic care is one of the most important things in healthcare today. So without further ado, thank you again for watching, you guys. Please subscribe to this video and there will be more coming soon in regards to this. Thank you again for watching. Take care. Have a great day.